Good afternoon and welcome to the Tuberculosis Education and Training Network webinar, Putting the Value Back into Evaluation by Collecting and Using Evaluation Data to Improve Your Trainings. This webinar is jointly hosted by the TB Education and Training Network and the Southeastern National TB Center. My name is Perry Hopkins. I'm a health education specialist for the CDC Division of TB Elimination, Communication, Education, and Behavioral Studies branch. This webinar is sponsored by the TB Education and Training Network. However, the findings and conclusions are those of the presenters. Today, we will learn how to put the value back into evaluation by collecting and using evaluation data to improve your trainings. This webinar will provide practical approaches to developing an evaluation plan and putting the data to good use by determining a training's effectiveness, its impact on performance, and how future trainings can be improved to better meet stakeholder needs. Our speakers today are Carrie Allbauer, TB educator and nurse consultant, Oklahoma State Department of Health, Ariel Gunn, instructional designer, Southeastern National TB Center, and Stephanie Nixon, training coordinator, Southeastern National TB Center. Before we get started with the presentations, just a few housekeeping items. Today's event is scheduled for 1 hour. The webinar is being recorded and will be posted on the CDC YouTube channel. As soon as it's available, I'll email the link to everyone who's registered, and you'll be free to share with colleagues and partners. You may submit questions for the speakers at any time during the presentations by using the chat function on your screen. Time permitting, questions for the speakers will be addressed after all the presentations have been completed. Glad everybody's joining us today, and I will now turn it over to our presenters. Thank you.
Thank you so much, Perry. So we're really excited to be here with you today. My name is Ariel, and so what we're going to provide today is a nice introduction to the evaluation process, and we appreciate everyone who registered, gave us some insight into your experience and the kind of questions you have. And so we're hoping that we give everyone something helpful to take away with them today. But again, this is kind of a nice introduction to the process of creating your evaluation plan. And we hope perhaps we'll have a chance to speak with some of you about any next steps. So next slide, Steph, thanks. So first we wanted to introduce ourselves in terms of our experience with evaluation, because we all interact with evaluation differently, and we don't want anyone to think that evaluation is not for them or they don't know enough about it. So Steph.
So my name is Stephanie. My background is probably what you would think of when you hear evaluation. I took classes, got a certificate in evaluation. I'm a member of the American Evaluation Association, so I really do big picture program evaluation. I am like your typical evaluator. So that's how I interact with evaluation.
Carrie.
And I am a TB nurse educator and nurse consultant. So mainly with evaluations that I have been introduced to is what I was when I first signed on to do this job, which was about 1.5 years ago. So I don't know very much about it, but I would like to expand my evaluations.
Awesome. And I'm an instructional designer, which means that I really focus on measuring learning or evaluating how well participants are learning both during and after the training. So we just want to emphasize that everyone interacts with evaluation differently. So there's not one different kind of background to come to, but evaluation is helpful for all of us. Next slide. So before we get started, we just want you to know that we hope it'll be interactive. We're going to have polls and they're anonymous, so don't feel embarrassed or shy about telling us what you're thinking. You can use the chat we'll ask some questions and you can put your thoughts in chat. And then if you do have any questions you'd like us to answer at the end, if you could put those in Q&A, and that'll help us kind of keep those organized. We also have slides and handouts that we'll give to you. We'll have a handout that we'll post in the chat here in a couple of minutes, and then we will email the slides to you with the evaluation within 5 business days. All right, so we're going to start with a temperature check. We're going to start with some polls to, I know it might be lunchtime or just after lunch, so we'd love to hear from you. So which best describes your current feelings about evaluation? Are you overwhelmed? Don't know where to start? Maybe you're optimistic. You are, you think evaluations are helpful and you're ready to learn. Meh, not sure how helpful they are. Maybe they're just kind of a hindrance, or you're excited. Can't wait to take them to the next level. So, oh, we love seeing you participate. Thank you so much.
Oh, we got a lot of optimists.
We've got a couple folks who are feeling overwhelmed, but for the most part, people are super optimistic. Well, awesome. We are glad that you're here today. We are also optimistic about today. All right, so we're going to go ahead and close that poll. Thank you to everyone who participated. We hope that was easy to do. All right, so let's look at that next question. All right, so which best describes your approach to evaluation? And remember, no wrong answers. So before you develop a training, do you identify the purpose of the evaluation, create the questions you want to answer, and then develop your data collection plan? Are you option 2, before you deliver a training, you maybe quickly draft a survey or grab one that's already in the office? Or option 3, I've never developed an evaluation plan for a training. Again, no wrong answers, just where you are.
It looks like so far a majority has never developed, and about even on the first and the second one. I love this participation.
And we're at almost 80%. That's awesome. Awesome. So it looks like almost half of us here have never developed an evaluation plan for training. So we hope that we'll give you some good information that'll provide you what you need to get started. All right, so we'll go ahead and close that poll. And I think we've got one more. Okay, so the final poll before we get started. How would you answer this? I know where to find resources to help me create an evaluation plan. Yes, definitely. No, I have no idea where to start, or I don't know, maybe I know where to Google.
Google hasn't let me down yet. Okay,
Split.
yeah. And that's
All right.
not too surprising.
Yeah, so we've got some folks who are saying, yes, I definitely know where the resources are. So when we share chatbot, so when we share resources at the end, if you've got anything to add, we'd love to hear from you. And we've got a lot of folks who are here and ready to learn. So Stephanie, take it away.
Yeah. So I am going to start by just kind of laying the foundation for evaluation, because before we really get too far into this, we want to make sure we're at least starting off pretty much in the same field. So we're going to start off with a poll, if that can go ahead and be launched. And so I want you to think through what are some of the reasons why you personally conduct evaluations, and you are able to select all that apply. So as many as you do, go ahead and select those. So maybe it's to meet CE/CME requirements, like, well, we have to do it, so we do it. Maybe you want to gather attendance data. Maybe you want to see if your participants like the training, see what worked well, see what you can improve, see if your training met its goal. Or maybe you're one of those people that are saying, wait, was I supposed to be doing evaluation? And that's okay too, because there are no wrong answers. Okay, it looks like a majority of you are trying to see what worked well, what can you improve, and to see if it met its goal. I see about 45% of you are saying to meet CE/CME requirements. Okay, yeah, so it looks like the bulk of you are trying to get an idea if your participants liked it, what worked well, what you can improve, and to see if training met its goal. So thank you for participating in that, and we can go ahead and close that. So evaluation, why should we do it? Why does it matter? So this is really a systematic way to help answer questions about not only the quality of your training, if people liked it, but just to see how effective was it And is your training of any value? So it really can be used to measure, is my training meeting the needs of my learners? Do I even have the resources and materials necessary to deliver this training? I always have great ideas, but that doesn't mean I have the resources to do it. Did I implement this the way I planned to do it? Did this training achieve its goals? What worked well and what can be improved? And I think you forget about the last one. Can I replicate this in other areas? That is an important aspect of thinking through evaluation. So we are obviously talking about evaluations for trainings, but just know you can use this process for other areas of your work that you want to evaluate. So these are the four most common types of evaluation. You're usually going to hear about one of these. We're not going into a lot of detail, but we just want to make sure it's on your radar and make sure you kind of understand the terminology. So we have formative evaluation, and that's really what we do during development, is looking at feasibility. So who is our audience and what do they need? Will this training address that need? We also have process evaluation. That usually occurs right after the training, but it can also occur as you are conducting your training, because that allows you to pivot as necessary. So like those questions are kind of answering, like, is my training being implemented the way I expected it to? Do we have the necessary resources and support? Now, what people are most familiar with is probably that outcome evaluation. So that's usually measured right after the training and looking at how effective it was. Are we making progress towards meeting our goals? And then impact, which is more difficult to measure, that area we'll go over, but that's really answering, is my training achieving its ultimate goals and outcomes? So naturally, you're going to say, well, this is great, but then if this is so wonderful and we should be doing it, why are we not doing it? What's the barrier? So number one that we hear across the field, and especially in the world of TB, it takes time. It takes time to develop it. It takes time for the learner to take it. And we're all guilty of getting surveys and we click, click, click just to get to the end and be done and get our certificate. It takes time. There's a timeline of when to send it if you're the coordinator, and there's a timeline of when you, the learner, has to complete it. It just takes time. Maybe you don't know what resources to use, or you didn't know there's a better way to do it. We are all tired of taking surveys. Everybody has a survey. McDonald's has a survey. We have bias against surveys at this point. And some people just don't know where to start. So if we are wanting to measure our impact, or we're wanting to measure our outcomes or our processes, you're probably naturally wondering, well, how am I supposed to know what those program activities are? Or where did the outcomes come from? Or how am I supposed to even choose an evaluation type if I don't know the answers to these questions? So that's what we're really going to walk through next. So I'm going to tell you to take off your evaluator TB hat and put on just your regular everyday person hat. So think about the last time you took a road trip. It could be any road trip. It could be 2 days. It could be 7 days across the country. Did you decide, I'm just going to get in the car and I'll start driving? I don't know where I'm going. I don't know when I made it. I don't know what I'm supposed to take. Did the kids even make it into the car? Did my husband or wife or partner get in the car? I don't know. Did I bring clothes? Did I even bring my wallet? I don't know. Or did you sit down, think through, okay, well, where do I want to go? How much is this going to cost? How much time do I need off? Can I rent a car? Or maybe I should fly. If I'm going to drive my own car, does it need an oil change? Maybe you want to figure out, like, well, where can I stop along the way? I'm one of those people. I've got an itinerary planned down to the minute. I know when I'm leaving. I know I'm eating breakfast. I know the time duration of wherever I'm going. I have got a whole plan. And at the end of your trip, you can look back at your, what I call a trip binder or an Excel sheet. And then you just naturally talk with your family like, yeah, that was great. That worked. Or that was horrible. We don't need to do that route again. All you did was plan a trip and you evaluate it. That is all program evaluation is. It's not as exciting as a road trip, unfortunately, but we do need a map to tell us where to go and if we made it there. So the whole time, think about evaluating your training as it's simply a roadmap, and I just need to know how I'm getting there and how I know if I'm there. So these are some key questions that you want to be thinking about as you start building that roadmap. Because again, you have to start at the beginning and you're going to have to do some planning to figure out where you want to go. We are not hopping in the car with no plans. So you first want to ask, what problem am I trying to solve? Number two, what do I need to make that happen? Then three is a mixture of the two. Who am I trying to help or serve, and what will my final product be? What are the first changes you expect to see? What changes in program or your practice are needed to reach their vision? And if you get this right, you get it perfect, what does success look like? So those are your 6 really key questions you want to focus on. So I'm going to show an example of a TV conference that we did in Guam where we went through this process before we ever started planning. So this was our roadmap. It looks busy. That's because it is. If you conducted a training, it is a lot busier than you think. It is why you were tired after you finished doing your training. You need to think through what resources are needed. You need somebody to teach. You need somebody to plan. You need somebody who has an idea about education. You got to evaluate. You need tech support. More often than not, that is all one person, which is crazy, but we all wear a lot of hats. What is it that we're doing? That might be your presentations or activities. Who are you trying to reach? Our final product was a 2-day conference. What are those short-term changes? A lot of times those are knowledge and belief. And then you start going into medium-term changes and long-term changes. So just to note, the goal of this webinar, we are not teaching you how to put this beautiful roadmap together. You need a whole day to learn how to create that. But we do want you to understand there's a process for determining how to create your roadmap. Like you never planned a road trip in one day. It takes time, but this kind of helps you figure out like what's going to work or not. So for the rest of this webinar, we are really honing in on this yellow box, what's in the yellow box, just those short-term changes. But we really want you to be able to see how does this piece we're about to learn fit into my roadmap as a whole. So think about those short-term changes almost as a pit stop on your general journey to evaluation. So I am going to turn this over to Ariel so we can start getting into like what I call the meat of this presentation.
Thank you, Stephanie, or maybe the tofurkey, since I'm a
Or tofurkey.
the tofurkey of the fake meat. Awesome. Thank you so much. So a few minutes ago, I put a handout in the chat. I meant to just have it ready to go and I accidentally uploaded it while Stephanie was speaking. But it's a worksheet that we developed from some great resources that the CDC provides online for 3 steps to creating evaluation. And we kind of turned it into a little worksheet that we're going to work through here today. And you can download it now and follow along. But we really intended it to maybe be helpful for you after this training to get you started, but we will be going through it with Carrie. So we're excited to show it to you. All right. So yes, thank you, Stephanie. So there's 3 steps to developing our plan. And the first step is that we want to determine our purpose for the evaluation. And so we've got some questions here for us to answer to help us with that. So first is, what stage of development is my training? So for a new training, Stephanie, if you click, yep. If a training is not yet created, maybe formative evaluation might be appropriate. Who's the audience? What do they need? Will a training address their needs? Is this the training to address the needs? If a training is new, you might want to ask process related questions. Is my training being implemented as I had intended? Do we have all the necessary resources to make it a success? And then if something's established, we might be ready to start looking at the outcome or the impact. But of course, if it's brand new, it might not be time to yet look at the long-term impact of it. But these are just some frameworks to kind of help us get started. So the next question is, who are my stakeholders? So stakeholders are have an interest in or affected, next click please, have an interest in or affected by the evaluation and its results. And it could be an individual, it could be you as the trainer, it could be an organization, it definitely includes your intended audience or learners, it might be the health department, at the local level, at the state level. The next question, what do I need to know and what do my stakeholders need to know? Now, sometimes these overlap or they may differ a little bit. So if you're the trainer, you may want to know whether the presentations are clear. If you're the trainer or maybe the supervisor or from the state, you may want to know, are there knowledge gaps that are persisting? Why are there knowledge gaps persisting after that training? Whether or not people are able to apply what they've learned on the job. And if they're not able to, what does that mean? What do we need to do? The next and final prompt from this first step, how will I use the findings? So it's good to have a general idea. You may not know exactly how you'll use the findings because you don't have your findings yet, right? But it's good to have a general idea, but you want to be open to discovery. You want to be open to, whatever the evaluation yields. And some examples of this is you may be going in knowing that the training needs to be updated. Maybe it's a little dusty. So you want to revise it. Or maybe you want to request that you have the resources to revise the training. Or there's good stuff in this training, you're hearing good things, and you want to duplicate what's working in this training and apply it to other trainings. All right, next slide. So the next step in developing your evaluation plan is to develop your evaluation questions. So again, we're going to think through how we've answered these questions from step 1, stage of development, who the stakeholders are, what I need to know, what the stakeholders need to know, and then how I'll use it. And then we will try to figure out what are our larger questions that we'll want to answer. So here's some example questions. And these may be questions that are relevant to you, or you may have different questions, and that's okay. These are just some examples. Do we have the resources and support necessary to deliver a high quality training? Are learners demonstrating the skills and knowledge we want them to gain? Or what barriers exist to implementing the new skills after the training ends? So these are just some possible evaluation questions that you might want to ask. All right, next slide, please. So the next step in creating your evaluation plan will be to choose your data collection methods. So you really want to consider what you need to answer your question or questions. So we'll go beyond training attendance data. Surely we definitely need to know who came. We probably need to report back that they attended, but we really want to go beyond that. It's a good idea to use multiple sources of data. Probably a lot of us are familiar with those post-course or post-training surveys. And they can be really good at getting at learner perception questions, but likely we'll want to add different types of data collection methods. We can also expand our respondents. Typically we ask learners, but we might be able to talk to their colleagues, managers or supervisors, patients, state org. There might be other respondents that we can talk to. We want to then also be strategic with the timing. We might not be able to find out long-term impact right after the training, right? We have to have some time elapse, but that might be a great time right after the training to kind of find out people's perceptions of the training. And then also we want to factor in feasibility. So you might be asking some really big questions about impact, and that might take a little while to kind of get your ducks in a row to be able to answer that. We want to encourage you to ask those questions, but we have to be realistic. We have to know what's feasible and what we can gather. All right, next slide, Stephanie. Thank you. So thinking about possible kinds of data collection methods that we could use. So the one that's probably most familiar to us, gathering data about learner perceptions. What did they think about the training? Again, we can use a survey. We can also use something called a CAT, a classroom assessment technique, where we might be able to, find out how they're feeling about things. Hey, is this presentation going too fast, too slow, or just right? That's a real quick, informal way to just get instant feedback. We call that a CAT. If we want to measure confidence, then we could use a pre-post test where we find out how confident people were about a skill or knowledge or particular piece of knowledge before they started, and then how what their thoughts are after. The next Learning, if we want to measure learning, a survey is not going to do it for us, right? We won't be able to ask them, did you learn? We want to test whether or not they learned. So a pre-post test, like a knowledge check, some kind of graded assessment, maybe a case activity. I'm lagging on my end, so I'm just going to turn my video off for a second. So maybe a graded assessment like a case study where folks go through a case together in a training, or maybe a quiz after a presentation. If we want to find out whether or not our learners are able to demonstrate the skills that we want them to learn, again, a survey is not going to do it for us, but they might be able to do a role play during a training, and we can see how they're able to apply what they're learning. Or maybe it's on the job observations or document review, looking at how well they fill out their cases, their paperwork for their cases. And then finally, outcome or impact. Again, survey is not going to help us here. We're probably going to have to do observations in the field, document review, or maybe even focus groups of supervisors to see how things are going. And before we move on to the next slide, we just want to acknowledge feasibility. We've kind of got light pink here on the left. You know, it's not hard at all to put together a survey or even a pre-post survey, but it does get a little bit more challenging when we're talking about measuring skills or outcome and impact. And we just want to acknowledge that. We don't want to discourage you from thinking about those things, but we want to acknowledge that that does require more time and resources to measure. All right, next slide. Okay, so thank you for listening to me talk. Now we are so excited to have Carrie join us, and we're actually going to work through this together, and she's going to tell us a little bit more about her training. All right.
Okay.
Okay, so Carrie, we're going through step one, so we kind of have to understand what your evaluation purpose is. So what stage of development is your training in right now? Like, is this brand new, you just came up with it? Or is this more like we've been doing this, so it's already been established? Like, where are you at with this training?
So the training that I took over, we have been using for many years. It's been revised and updated, of course, by previous employees or employees that are still in our program. And I have been in my position for 1.5 years, and I kind of took on this training that has already been developed. So I didn't like recreate the wheel, but we have revamped it. And I feel like we always kind of revamp it each time after. When I do a follow-up survey at the end of our trainings. So I try to help whatever they were wanting. So I would say it's decently established and always being updated.
Okay. Established and then constantly being updated.
That sounds familiar. So next question, Carrie, tell us a little bit about your stakeholders.
I would say our biggest stakeholder would be our county health department. Nurses are the ones who get the most out of these trainings, need the most out of these trainings. Of course, their leadership and my leadership are also evaluating how my training is affecting our TV and things like that. And ultimately, CDC is a stakeholder when it comes to seeing how our nurses are seeing our patients and how it's coming across through our electronic medical record.
Okay.
When it delivers information to CDC.
A lot of stakeholders.
Yeah.
Should sound familiar to a lot of folks.
You're right.
Everybody's going to want something different.
Kind of like your short-term, long-term kind of stuff. How's it going to affect long-term?
Absolutely. Okay, so given that you have a lot of different stakeholders, what is it that you need to know from evaluation? And then I guess the second question is, what is it that your stakeholders need to know?
Ultimately, what we need to know is, did they learn what they were going to learn? Are they having confidence? And are they able to, the big stakeholders is, are they able to put it into our electronic medical record to perform their job?
Okay, that makes sense. So it sounds like you like you said, you are looking more at that short term, like, did they get it? Are they confident that they got it and they can do what they need to do? And then your other stakeholders are really looking at, can they perform the job and document it correctly within your system?
Mhm.
Okay,
And so Carrie, how do you imagine you'll use these findings?
Ultimately to improve training and the process of training, make sure that nurses have the knowledge and tools that they need to provide care to the TB and LTBI patients out there.
awesome.
Wonderful.
Okay,
Thank
so
you.
it sounds like you've got a pretty solidified evaluation purpose.
Yeah, trying.
Okay, so it sounds like we will come up upon another interaction where we're gonna have you post in chat, and I'll have Ariel kind of walk through the first question we want y'all to answer.
Yeah, so we want to hear from you all. Get your fingers ready to type in the chat. So based on what Carrie said, what stands out to you as maybe the highest priority need to know for this training? There's no wrong answers. We're just looking to hear your thoughts. And if you'll put this in chat, everybody can see chat, but only the presenters can see Q&A. So. So quiet.
It is. This comes to silence where we wait for things to start popping in the chat.
Okay, some things are starting to come in. Ah, thank you. Here we go.
Let me go back. I saw, Leanne, I saw you ask if we could go back to the choices again, so I just popped back up a summary of what Carrie said.
Oh yeah, thank you, Leanne. So I'm seeing here designing the evaluation for the actual information. So I'm thinking maybe making sure that the evaluation is designed around the training itself. Appropriate documentation of activities. Yes. Yeah. Carrie, are you able to see these?
Yes. I
Okay.
see someone had asked who's the primary audience of this training. This training is for nurses that I were discussing. So that would help to understand what it's about.
So Kylie is saying whether the trainer or program is training effectively, if it's communicating what it's intended. Great observation. There's a question about developing valid questions. We'll try to talk about that a little bit more. Question about when to send the evaluation.
I love what Trudy said. Is it usable? We can present all the great information in the world, but if you can't do anything with it, it's pointless.
Right.
Okay. I might say this wrong, Simon or Simone. I'm going to go back to that first question that everybody's answering, which is what stands out to you as the highest priority need to know for this training?
And Angela has a really good point. There are so many domains encompassed in a TB nurse training. How do you select the need to know for one region as opposed to another region? Oh, Carrie, does that resonate?
From one region to another region, man. In Oklahoma, I feel like we have very different cultures, which I'm sure is in many states. So definitely different.
Mm-hmm. Okay. Thank you, everyone. So let's look at this next question, Stephanie.
Yeah, here we go. So second question that we would like you all to put in chat as well. Based on her previous responses, what is an evaluation question that Carrie might ask?
This is a hard one.
I love that Simon said goals and objectives. You're speaking our language.
Yeah, and Kate pointed out, do you need to look, are you looking at skills and whether the nurses can do what you train them on? Yes, absolutely. Do you need to look at how you are evaluating their learning? Yes, absolutely. Great comment, great question. So it's interesting too. I think people are imagining that their audience for this question are the learners. You are the audience for this question. You are designing your evaluation questions for yourself. So this is not necessarily like one evaluation question that you'll be asking your learners. This is a larger question that you're developing for your plan that you will be answering.
So you may be thinking about, well, how, so I would, as I'm listening to Carrie, I would think, well, how do I know that they learn what I taught them? Outside of just their perception that they learned it.
Mhm. Awesome. These are some great suggestions. And we also got a good reminder from Cheryl. Thank you, Cheryl, that when you go to you have the option to either post to just the hosts and panelists or to everyone. So if you want everyone to see your comment versus just us, you'll have to select everyone. Thank you, Cheryl. They're probably like, what are they reading? Private messages. Okay, so I'm seeing some good potential questions that might be able to use in a survey. So let's go to the next slide and kind of show the questions that we developed with Carrie. And this is for her larger evaluation plan, not questions that are going on a survey. These are the questions she wants to answer as part of her plan. So she's asking the world this. She's So Carrie, do you want to kind of walk us through these questions and why you selected them?
Well, did they learn what we hope that they would learn? Ultimately, we want to see how much of the training that they actually retained and are able to use to apply to their job. And the biggest thing is, to me, when they go back to their county health departments, because majority of all the people that come to my trainings are county health department nurses, do they have the confidence in their skill? Has that improved now that they have a little bit more knowledge, know where the resources are and their skills for being inside? I know that sounds crazy, but just ultimately learning the process of the electronic medical record can sometimes be very overwhelming for anyone learning a new system when they start a new job. So hopefully confidence has improved. And are they able to apply what they learned after the training? So some of our counties are busier than others. And so sometimes that doesn't always happen. They're not always able to utilize their knowledge right away. So we want to make sure that they have the resources for when that time comes, that they'll be able to feel confident in performing their job.
Oh, thank you, Carrie. That was fantastic. And I mean, let's explain for everybody. It took a couple conversations to get to those larger questions, right?
For sure. Yeah.
We didn't sit down in 5 minutes and say, what are your evaluation questions, right? It took a conversation for all of us to kind of figure out what those questions are. So don't feel bad if you don't know them immediately when you sit down. You really have to think through a lot of different factors.
Mm-hmm.
Definitely a lot of questions can come up, and you can kind of categorize them and put them together too.
Yeah. Yeah, we had fun working on this with Carrie, thinking through her training.
I like to say it took about three 1-hour meetings for us to kind of talk through the whole process and get down to those evaluation questions. So like Carrie and Ariel said, don't feel bad that you could not think of 3 in 2 minutes, because it took us 3 hours.
I feel like the people on this webinar have done great though. They gave us many questions and evaluation tools even on what to evaluate these questions.
Absolutely. And they're asking really great questions too. I'm jotting them down because some of them are going directly to us, so we can come back to them.
Okay, so what we're going to do now, we're going to kind of poll you. And this is really going kind of off of what you all just started talking about. So it's like, we're about to present. So this first poll, what would you use if you wanted to evaluate learning? And you can select all that apply. So would you, if I wanted to evaluate somebody's learning, do I send a survey after the training to ask if they improved their knowledge? Do I give them a pre-test, post-test with factual knowledge questions? Do I do a case study activity? Or maybe I do like an informal classroom assessment activity that Ariel mentioned, like Money's point is, where am I most confused? Or I really don't understand XYZ. What would be the things that you would use if you wanted to evaluate if they learned something? And then I'll even throw in a caveat. How do you evaluate it objectively? So think through your answers and see, is that an objective way to measure their learning, or could it be biased or skewed? So I see majority of people are saying pre-post test. Almost tied with case study in that survey after training. There you said the CAT.
I know, and I feel like I need to give them a little bit of I need to give CATS a little shout out. So, you know, as the instructional designers, like, I want to comment on this one. So yeah, how do we evaluate learning? You know, can we ask people, did you learn? Does that really give us an objective, what Stephanie was saying, does that give us an objective measure of whether or not they learned? We want them to be able to demonstrate that they learned something, right? So this pre-post test with factual knowledge questions is a great way to measure their knowledge before they started the training and after the training. A case study activity, it didn't get a lot of love, but a case study activity going through is a great way to measure whether or not folks learned something. A really active learning activity where they have to grapple with a real world example. And then let's see, informal classroom assessment activity. I want to give these, there's a link in the slides that we'll give to you, but I really want to spread the word about CATS and how helpful they could be. So these are little activities like a poll that we're doing right now that are informal to gauge people's understanding of a concept. I think, Carrie, you mentioned a muddiest point activity, which is where you ask folks, what was the thing that you have questions about, or was muddy, you know, a point of confusion? You mentioned you did that. I'm like, muddiest point. And that's an example of a classroom assessment activity where if you ask that after a long day of training and people gave you their muddiest point, you know that that's a good thing, that you get instant feedback about their whether or not they learned what you hope they would learn. And maybe that's something you want to review. I'm getting some head nods from Carrie.
I love doing that. My training is a 2-day training. So first day is like, wham, we fill them with tons and tons of knowledge. And so by that second day, when we start the day, I tend to I want to hear something great about the training the day before, because I like to have an up, just letting y'all know. Sometimes it's nice to hear good things, but then also to assess, like, what do we need to hit harder on today? Or what do you feel like was just like, whoa, I didn't get this yesterday. And so definitely I like to touch base with them in an informal way. I don't do a lot of pre and post tests. And so I think that got the most amount of percentage. And I think that is something that I have been thinking about making sure I implement into my trainings. So I like that everybody put that.
Yeah, absolutely.
And I love to say about like surveying after training, I love to pick on myself. I've sat on a ton of TSC trainings. If you ask me, did I improve my knowledge on placing a TSC? And I am not a nurse. I can say, yeah, you put it in at an angle, go right beneath the skin. I should get the little wheel. And then if you gave me a needle and solution and told me to do it, I wouldn't be able to do it. But I was confident that I improved my knowledge. I thought I knew how to do it, but I can't demonstrate it.
So my takeaway from that example is surveys are not actually great at measuring whether or not knowledge has increased.
Definitely.
Awesome.
Okay, we're going to go on to our next poll. Thank you, everyone.
Thank you.
So what would you choose if you wanted to evaluate an increase in confidence in a skill? So Would you maybe ask participants to give a thumbs up if they feel confident? Maybe you do a survey after training where you do ask them, did your confidence increase? Or maybe a pre and post test that asks about confidence levels before and after the training. We're staring, when you see us in silence, staring at the screen, we're looking at how the results are coming in.
And they're coming in slower than last time, so I think they're starting to experience polling fatigue.
The polling survey, that bias that we have.
So we're about at 62%, and I'm seeing a strong lead with the pre-test, post-test that asks about confidence levels before and after. And that would be what we would recommend, that you really get a good baseline at the beginning, and then you get a sense at the end. Now, you could ask if their confidence increased after, but you really wouldn't have that baseline. But we do see that, and that is a method to evaluate confidence. But if you've got the chance, a pre-test, post-test would be ideal. Thumbs up if they're confident. I don't know if everybody's looking at them. I mean, if a trainer says, how am I doing? You feel good? I'm going to say I'm feeling good, even if I'm not, because I don't want them to feel bad that I'm not feeling good. So I don't know, take that with a grain of salt.
Yeah,
Right.
or the opposite way, if you're in an in-person training and you see a couple of people in front of you put a thumbs up, you were going to say they all got it. They all said it was great, when really you only saw 3 people in the front row put the thumbs up, and you missed the other 5 rows who were not paying any attention.
We've all done it.
I really like that someone put in the comment box, and it is 100% true, is evaluation of confidence is very difficult. And so they didn't say very, but I will add that in. It is very difficult.
Yeah, good point.
Yeah. Okay, this last poll that we've got in this little segment, which will evaluate whether learners are applying the new knowledge and skills. So are you going to ask them a survey where you just ask, are you applying the new knowledge? Are you going to observe them? Maybe you will look at their documents or their charts or the electronic medical record. Maybe you'll do interviews or focus groups, and you can do that with the supervisor who would be observing them. Like, what would you choose to evaluate? And I'm not talking about what's feasible, just in a perfect world and you had unlimited resources, what would you choose? Unlimited resources, no HIPAA issues, no issues with systems.
I'm
Okay,
seeing a
okay.
lot of people choose observations would be their favorite way. That would be a really excellent way to be able to gather if people can apply it. Might be challenging, but it would be an excellent way.
I see most people aren't choosing surveys. I'm proud.
Carrie, what do you think of some of these responses? What would your ideal way be to evaluate whether or not your training is being put into practice?
If I had everything feasible, I would say going out into our counties and being able to visit and see work in the real world would be the best way. Observation. I can do some of it just sitting at my desk and seeing their electronic medical records. So that is an observation as well. But in the real world, seeing their confidence level, seeing how they really feel, seeing how this patient is being treated, things that are being educated to them in the real world would be my favorite. But I like patient care, and I love seeing people, and the timing and just things like that is not always feasible. But
Yeah.
Document review is probably another big thing that I would have to do.
Gotcha. Thank you. All right. Well, that was fun. Thanks for participating in the polls, folks. So just to kind of wrap this up, and folks at home, you can think about this, but Carrie, just a little reflection. Did going through this process with us change your approach to evaluation, or change maybe your thinking about evaluation?
100%. It definitely, and even today, after even our many meetings that we have had, has kind of changed how I feel about even other approaches. I feel like some of the comments from the attendees of this webinar have even changed how I'm like, oh, I didn't even really think that that would be as important. But now that you're saying it, man, that is such a good way, you know? So there's a lot. So it can definitely improve, and no matter what, it will improve just by giving it your time.
Good point.
And you can have fun while doing it too. We have had a ton of laughs as we've been working through this. It can be fun.
Yes.
And Carrie, what would you say your next steps are now that you've thought through creating your evaluation plan? What would your next steps be?
I think approaching instead of somewhat changing up my follow-up survey. I know a majority of people were against surveys, and that is the main thing that we do to follow up. But maybe changing it up to be more or less a combination of a survey / post test to kind of evaluate more things such as their knowledge and confidence. So it'd be great to kind of help out with that, and just putting into even my PowerPoint more of the informal discussions on how are they learning? Are they absorbing what they're learning? Are they feeling confident about what they're learning?
Awesome. And thank you for allowing us to clarify that, yes, surveys, we're not advocating getting rid of surveys. We just want folks to know that what you can measure with the survey is a little bit limited. So you may want to add to that data collection plan, but thank you so much.
Okay, so we are keeping an eye on our time. So we're gonna briefly go through interpreting and utilizing your results. This is a whole semester class in itself. So we are giving you a little nugget of information. So when it comes to interpreting your results, so you want to look at your data points, and there are several ways that you can kind of summarize what's going on. You can just eyeball it. You can look at your pre and post tests and see that a majority of people increase their knowledge. That is still a way of interpreting those results. If you have a passion for statistical analysis, I do not. You can run statistics on it to see if it was statistically significant and see what's going on there. You can kind of just look at qualitative feedback and just get a general sense. Again, you can take it the statistical route and really dive in head first if you are passionate about qualitative data analysis, or like you could just look at document reviews, look at some of those activities you did in class. Did they get it? If they didn't get it, that might be a piece you need to improve next time, but you may still need to do follow-up. You cannot cover everything in a 2-day training. It's just not going to happen, but you might know, okay, I need to follow up with them on this aspect. Anybody who knows me, I have a strong passion for Disney, and there's a great scene in Hercules where the Fates are talking to Hades and they say a word of caution to this tale. So I'm giving a word of caution to this tale. Your results are not going to tell the whole story. So for example, we ran an online diagnosis and treatment. First time we ran it, we were so excited. We had group activities and breakout sessions. They had case activities, and it got lukewarm reception. People were not as excited as we were excited. We actually didn't really give them instructions, and they couldn't figure out how to download the case worksheet. And then they only had 10 minutes, but they couldn't figure out how to get into the breakout room. Then they had issues with audio. So it wasn't that the activity itself was bad, it's that we need to improve our process. Or let's say you have a pre and post test and they did horribly on the post test. That doesn't mean that your training was bad. Maybe there was a tornado that hit, which has happened. Or maybe you had your training at a correctional facility and they had gun range practice, which has also happened on a training. So you still need the context, and that is still important to tell your whole story of your training. For all of your data points, look for your themes, rely on outliers at your own risk. It's very easy to focus on that one person that said this was the worst training I've ever had in my life, and you need to change all of it. Those comments stick. But if that's one person and 50 other people said it may not be, maybe they had a bad. So rely on outliers at your own risk.
Trust but verify. Jose, yes, thank you. It's good to what the evaluators call triangulate your data. So it's a good idea to get confirmation and get multiple points of confirmation. Surveys are not the best option. Surveys are not the only option. Maybe let me clarify. Surveys are not the only option. We want to add different points of data collection to be able to measure their learning and impact as well. Surveys have their place, but we don't want to only rely on surveys. Measurable data, try pre-post. Pre-post is almost as easy as just a survey. It's just a little something at the beginning. Yeah. Practice, practice, practice. Yes.
I love Angela said evaluating the big picture, not just evaluating the learner, because we don't just work in silos. We do have to look at the whole system and what's going on.
Yeah. So I did see two questions that seemed that kind of popped up throughout, and someone just posted about it. There was a question about delivery. How do you make sure you get people to fill out your surveys, or how do you make sure that you get the data that you need? So delivery methods and timing. So we were talking about, you know, surveys, activities, but I think there was questions about like, how do you make sure that you get it to folks at the right time? Do you deliver it electronically later on? Do you give them pen and paper? I'm strongly biased towards online because then I don't have to manually enter their data. So, you know, if you can do a QR code and pull it, you can do it right as the training is ending, but have a QR code that they go to. That way you don't have to enter the data, enter their survey responses.
And I guess that does go back to feasibility and available resources. If you've got a team of interns and they've got time, I think paper does give you more feedback, and then you have the resources to enter it in. But if you were the evaluator and the trainer and the tech person, and then you have to be the data person who enters it and evaluates it, you may not have time to enter it all in, or it would have to be very surface level. You can type paragraphs. And you'll be a teacher trying to interpret handwriting.
Yeah, Angela said, yep, just me. Yeah. So, you know, if you pen and paper, there's nothing wrong with pen and paper, especially giving it to them right as the training is ending. You'll probably get increased completion if you were sitting there staring at them as they fill it out. Later on, they get busy, but I know Carrie said that she doesn't like having to answer right then. She wants a little time to think about it. So that's a really good point too. And in the handout that we put in the chat, and we'll email you, there's also, there's a little table about timing of different data collection methods. You know, some things you may be doing in the moment. So you might be assessing their learning during the training. You may have activities where you assess their learning during the training. And then, you know, the observations, the long-term impact, you'll be doing that weeks, months later, right? So you might have different types of data you're collecting all at different times, before, during, after, and then way after.
And just to kind of sum this up, because I see our time, we do like to practice what we preach. So we do have a roadmap that we created for this webinar, and we do have our data points that we want to collect, and we'll still be following up with more than one evaluation, probably over the next couple of months, just to follow up and see how you're doing. So don't be alarmed if you hear from us in, like, let's say tomorrow we want to get the evaluation out, and then hear from us again maybe in 6 weeks. We just kind of want to practice what we're preaching. This is a list of resources, and those are hyperlinks. So CUC has a lot of great resources about evaluation. If you are interested in creating, implementing, using your evaluation plan, contact your COE. You do not have to do this alone. There's no reason for you to have to do this alone, and we're free. So, and we like free in public health. So take advantage of the resources. And before we let y'all go, we've got a post poll that should look familiar. We did pre-post. Which of these best describes your current feelings about evaluation now that you've heard this presentation? Are you still overwhelmed? Are you optimistic? Are you still like meh? I'm still not sure how helpful this is. I'm already excited, like, okay, yes, now I can't wait to take it to the next level.
So far, I'm not seeing anyone say they're overwhelmed, so we didn't overwhelm anybody. That's good.
That is good.
Oh, we've still got a couple meh. But we've got a lot of optimism and a lot of excitement.
Yeah.
Really happy to hear that.
And you see just how quickly we interpreted that. We didn't do anything fancy. We just remember what it looked like at the beginning. And we can just quickly look at what it looked like at the end. And we've interpreted our results.
Awesome. Well, thank you so much, Ariel and Stephanie and Carrie. I learned a lot. I hope our participants learned a lot. Thank you all for all the effort you put into putting this webinar together. And that will close us out for today. Thanks, everybody, for attending.
Thank you
Bye-bye.
for attending. Thank you.
Thank you.